Good, and yourself?
Good. Thank you.
Professor, so the next exam will be on next Wednesday?
Mhm.
Okay, thank you.
Yeah. If everybody would be putting their name and campus in the chat, I would greatly appreciate it. That'd be fantastic. I know we had a few people who sent me an email they were going to be late, so we'll get going right here at 1. Guys keeping up with all your classes?
Yes, ma'am.
Bye, I love you. Oh.
If everybody could put their name and their campus in the chat for those of you just coming in. Okay. This is a big class. Okay. So welcome to week 5. Can't believe it's week 5 already. Can you guys believe it's week 5? Next week is midterms. So a couple things. One is, if you currently have a grade lower than a 78, I'm still letting people in, or have attendance issues, or have homework issues, then I have to do what's called, and I'm sure you've heard of them, at-risk reports. Okay, and they go to your dean. Okay, we have at-risk meetings with your campuses every other week. Okay, so it's on a week 1 rotation, week 2, and then it keeps rotating. So every week I have to do at-risk reports for students with those issues. So I just want to make sure that you know about them, because if your dean is reaching out to you about whatever, review sessions or setting up a tutoring session with your instructor or turning in homework or attendance in class, that's why they know about it, because all faculty is required to do these at-risk reports. Okay, so I just wanted for everybody to know that. So I've got several emails this week from students saying, how did my dean know that I didn't do this or whatever? So I just want you guys to be aware of that. And then next week after the exams, we all have to do, they're called mid-module evaluations. So again, anybody's below a 78, attendance, homework issues, a mid-module evaluation I have to do, and I'll actually send that out to you, a copy of it out to you, and then we'll schedule a meeting. Okay, so anybody have any questions about that?
For the homework, I wasn't able to go into like the modules and do the end class questions. It's giving me an error message.
Right, and so that's going to be corrected, and so you have to go in through your other classes, or you have to go in through the Evolve website. The link is not synced. So that's how you have to do it for this term. Okay, until I already have an IT ticket in and they're working on it. Is this for, I know it was for our first set of NCLEX questions. Is it for the next set as well?
It's for the one that was due. That's due on Sunday, I think. Because I was able to do it from the last time from the modules, but not this time around.
Okay, I have an IT ticket in for them to look at all 4 NCLEX assignments. Okay, so for right now, other classes or through your Evolve account. Okay, that's how others have been getting around it. Does anybody have any other suggestions? Are other students having the same issue for this week's NCLEX assignment? Okay, I see a lot of head nods. So how are you getting around it for those of you that have done it?
I'm just going through my other classes and just
Okay.
going that way.
Okay. Paula, does that help? Was that Paula that was speaking? I can't tell. Paula, your Zoom is kind of goofy.
It's doing it in all my classes. I don't know, but no, it was not me speaking.
Oh, okay.
It was me. I had thought that prior to starting, you had told us that we couldn't go through like the Evolve website. That's how I usually had done it in the past,
Right.
but you told
Right.
us not to. So that's the only
Right.
reason
So
why I
now I'm correcting that and telling you to do that. Okay. Since the link isn't working. Okay. Over the weekend, when I sent out the week 5 announcement, I had a couple of things attached to it other than the PowerPoints. I had the exam 2 study guide. Just want to make sure everybody has seen that. Everybody come upon the exam 2 study guide. Got a couple of messages this morning that asked when the exam 2 study guide was coming out. So I just want to make sure everybody has seen that. Okay. I also sent out again the schedule for reviews. There are, well, now there's 6, but there are 7 live reviews for you to attend. Exam 2 reviews. One of them's already happened with Dr. Ford, and this morning I sent you out her recording. So you already have that recording. I believe there is 2 today, 1 tomorrow, 2 Friday, and 1 Saturday. You have the schedule. Okay, so really encourage you to try and get to at least 1 review, more than 1 if possible. As I say, there's a direct link for the great majority of students of attending live reviews and doing better on your exams. So if you can all try to prioritize to getting to at least 1, that'd be fantastic. I will be sending out all the reviews, the recordings as I get them. Okay. So you have 7 live reviews and 7 recordings. Okay, and you have the study guide. And as always, a study guide is a really good starting point for identifying concepts that were covered over the last 3 weeks. So we're covering for this exam weeks 3, 4, and 5. Okay, so you'll be doing exam 2 at this time next week. Okay, I'm happy to meet with anybody. I've already done a lot of tutoring in the last week and this week. Don't be afraid to ask for tutoring. Tutoring is not a negative thing. It actually tells me that you're engaged and motivated to figure out, where you went wrong on the first exam, or talk about test taking strategies or whatever. So I've really encouraged students that got below a 78 to reach out to me or schedule something. And I've met with a couple of students this week. One had the high 80s, one had the mid 90s, and they still wanted to meet with me to see what questions they got wrong. So I'm happy to go over anybody's review with them. As far as next week, what I've told some of the students for next week is, after you do your due diligence with preparing for the exam, study guide, PowerPoints, readings, whatever it is that you do to prepare, if there's still areas of the study guide that you are having trouble with, please reach out next week before the exam and set up a quick Zoom, and we can go over whatever you want to go over. Okay, so I'm offering that to you guys. The other attachment I sent in the week 5 announcement was your HESI study guide. Anybody open that yet? Okay, here's how I want you to look at that. I know it's a book. I know it's probably up to what, 60 pages now, but remember, this is the study guide for the entire term. Okay, so as we're going through each week, you can be checking off, highlighting areas of that study guide that were covered, or the HESI study guide. And we have put together the HESI study guide based on reviewing previous HESIs for this class. Okay, so the topics that are in the HESI study guide are topics that are covered. I don't know what the questions are. We don't do the questions for HESI. They come out of a bank, kind of like NCLEX, but we do know what the topics are. Okay, and so that study guide is not meant to be opened, the Sunday of week 11 before you take your HESI. That's meant to be kind of open now and just kind of peruse through it, and just so you're not stressing out about it. And as you go through it, hopefully you're thinking, oh yeah, we went over that. Yep, I remember that. And then it doesn't become so overwhelming, where if you pull it up at, the weekend of week 11, it's going to be pretty overwhelming to you. So that's just an additional resource for you guys. We we did update it this term based on last term's HESI. There were a couple of additional topics that were brought up, questions were asked about that we didn't have on the previous HESI. So that is your most up-to-date version. Okay. Does anybody have any questions about any of that? No questions? Okay, let's see. We've covered last week we covered weeks 3 and 4. Today we're going to cover week 5. Does anybody know what we're covering today? What are we talking about today?
I know we're going to be looking at environmental health.
Mhm.
At least that's what's I've been reading through the PowerPoints.
Okay.
Occupational health, because I saw there was an occupational health, video attached that I watched.
Did anybody else watch the occupational health video in the attachment? What else are we going to be covering today?
Also epidemiology.
Okay. Okay. Your discussion question this week. It was about outbreak, a potential outbreak, right? You were asked to decide whether it was a true outbreak and go through some questions. When we finish going through the content, we're going to do a case study that's also about an outbreak. It's from the Minnesota Department of Public Health, and it's about epidemiology and outbreaks. So we'll do that after we go through the content. So I thought this week I have the book pulled up because there are several important points in each chapter that we need to address that are expected knowledge for you that will be covered on the exam. Okay. So first, before I jump to the book, does anybody have any questions? About anything? How are you coming on your second group project? Everybody getting it together?
Yeah, we'll start working on it.
Good, good.
Ours
And
is
I'm
done. We just need to
hoping,
post it.
go ahead.
Ours is done. We just need to post it.
Great, great. I'm hoping that it's due in week 7. I'm hoping in week 8 that we can do, I can block out some time and we can do presentations from each group. Don't panic, but it's always nice to, I do this with my PN group too. It's always nice to hear from the group and what you learned and what you did, and we can all learn from your papers, but there's no additional prep work or nobody needs to create a PowerPoint. It's just simply pulling up your paper, what you submitted, and each group talks about it, what it was, what they learned. And so I'd like to try and do that in week 8. All right, let's go to the book. So we'll start with chapter 8 first, okay? Environmental health. What do we think of mental health? What's environmental health? What kinds of things are we looking for in environmental health?
A lot of people that do like chemical work,
Okay.
radiology work, kind of things that would put them at risk.
Okay, I'm having trouble with my Zoom here, so let me try and get out of here. 1 second. What else is new?
Climate change.
Okay, my back. Okay. Everybody see me and hear me? I'm in chapter 8 of the book, so I'm just going to go through a couple of things with you. So environmental health. Climate change, I heard. What else is environmental health? What about air pollution?
maybe like oil spills and stuff like that.
Oil spills? What about food contamination?
Like a salmonella outbreak,
Yep.
botulism, that kind of stuff.
What about what about water contamination?
Yeah.
Has anybody ever seen the movie Aaron Brockovich? Anybody?
Mm-mm.
Nobody has seen that movie.
I have. It's a great movie.
What's it about, Olivia?
It's about PG&E, which is a major chemical plant, and they are getting rid of water that's used in their cooling towers inappropriately, and it is spreading throughout the ground in this rural community and causing the lifelong residents of this town to develop some pretty nasty forms of cancer and affecting everyone from young children to the older population that lives there, and the legal battle that ensues for kind of the company to pay for the medical care of these people, since they knew that they were depositing contaminated water into the ground, and the fight over the millions of dollars that they were going to have to pay in legal fees.
So the movie's about an environmental disaster. Water contamination. Yeah. Think about all the environmental risks that we have in our communities, right? On any given day. What are the environment, what are what kinds of communities have different kinds of environmental risks? Environmental health is a huge part of community nursing. So we really need to talk about this. Think of your own community where you live in now. You go on day to day doing your thing. Are you aware of the environmental risks that are in your community? Like, does anybody live near an airport?
I live by Turkey Point
Which is
in Homestead.
it by an airport?
No.
Okay.
I meant the nuclear power point. That's what I meant. The Turkey Point nuclear power point.
Okay. Power plant. Exact. What about transportation? What about railways? What about communities that have high crime rates?
Well, I know down here in Florida too. For those of you that are here in Florida, I live in Okeechobee, and I know they like to talk about like the algae blooms and stuff like that a lot, like in the water over there on the coast in Jensen and stuff like that. They talk about that as well.
Sure. What about communities that have gang activity, increase in violence, increase in crime? What about communities that live in poverty? What about communities that live really close together? What other kinds of environmental risks do you have in your community? Transportation, do you live near water? Do you live near a lake? Do you live near the ocean? Do you live in a new subdivision? And how do we know what's below you is safe? Do you live near a sewer factory or sewer? What environmental risks do you guys have in your communities? You don't really think about them, do you? I mean, I assume that people are making sure that where I live, the air's is good quality, the water is not contaminated, right? The ground I live on is safe. The food I eat, if I go out to eat or go to a fast food, it's been prepared right. Do you make those assumptions? I do. What other environmental risks are you guys aware of? I mean, how does the environment influence health and disease?
We constantly breathe it in, or it's in the water that we drink or that we shower with.
What else? The environment influences health and disease exponentially. Old buildings, yep. Chasina, yep. Old buildings, mold, asbestos.
Probably also like chemicals that we like use and eat and digest, and all that also affects.
Yeah. What about gardening and doing landscaping and using chemicals on your lawn and using chemicals in your house? Cleaning supplies,
Pesticides.
pesticides. Lots and lots of environmental risks. Okay, so just going to skip through this chapter here and go to the important things. This is on your study guide. Okay, we're in chapter 8. I want you to review the Healthy People 2030 objectives related to environmental health. There's 3 of them. Okay, remember, Healthy People 2030 is a national advocacy for health for all. Okay, so one of their goals is increase the proportion of people that have safe drinking water. Increase the proportion of schools that have policies and procedures to promote health and safety. Reduce the number of days people are exposed to unhealthy air. We all see on our weather channels, right, that the air quality is poor, moderate, good. Fire burning is banned. We'll talk about epidemiology in the next chapter. Somebody mentioned climate change. Environmental risk, huge environmental risk. So on page 142 is an excellent box that is how to apply the nursing process to environmental health. Remember, we're using the ADPI throughout community and public health nursing. Okay, you use the ADPI differently in the hospital setting, in your clinical settings, in your wherever you work, but now we need to shift of how we apply the ADPI nursing process to environmental health. Or for purposes of this chapter, we're shifting the nursing process to environmental health. Okay, so I want you to have a look at that box. It goes through the entire ADPI. So for example, assessment. Okay, include inventories and history questions as part of the general assessment. Where do you work? Where have you worked? What have you been exposed to? Okay, so read through that box. As you're preparing to do a history with the client, box 8.2 on page 143, it's called the I prepare mnemonic. And in quotes, it's IPREPARE. And it gives you an idea of how you would do an environmental assessment. Okay, like I said, where do you work? Where do you live? What are environmental concerns in your community? Where have you worked in the past? What do you like to do with hobby? What are your hobbies? What kinds of resources do you have in your community to help with environmental issues? Okay, the 4 main environmental health concerns we have: air, water, land, and food. And this is in your PowerPoint. The other important part of environmental health is the right to know. We as caregivers in the community must be mindful that the public has the right to know. They have the right to know about hazardous chemicals in the environment. The other thing we need to be prepared to do is a risk assessment. Okay, what is a risk assessment? Right, risk assessment determines the probability of a health threat that's associated with an exposure. Children are very at risk for environmental exposures, environmental hazards, because poverty, lack of access to healthcare, dangerous environmental situations in which they may live. Right? Kids' immune systems are not very strong. So they're more susceptible to respiratory infections. Okay, their lungs are still developing. Okay, and then you have environmental risks or environmental exposures in kids that may cause chronic health conditions, autism, cancer, respiratory diseases, asthma, obesity. There's a lot at stake with environmental risks. All right. And obviously our goal as community and public health nurses is trying to reduce the environmental risks. Okay. It's the 3 R's: reduce, reuse, recycle, on page 147. Reduce consumption. Reducing consumption reduces waste and unnecessary packaging and non-essentials. Reuse. Choose reusable rather than disposable. And then recycle: paper, glass, cans. Okay. Levels of prevention, we need to look at that. It's on page 148. Levels of prevention in this chapter are specifically focused on lead-based paint. So as a primary prevention, we would teach or educate families on using only lead-based paint. Right? For secondary, who's at high risk for lead exposure? So secondary, if lead is found in the paint, remove the paint and replace it with non-lead paint. And then tertiary, with regards to lead exposure, is they're already showing signs of lead exposure. Right? So we would have to take steps to decrease the lead levels. Okay. Risk communication. Okay, really important with environmental issues. Risk communication involves making sure you're giving the right information to the right people at the right time. Okay. Some of the roles for us as nurses for environmental health: we certainly are going to be involved in the community, public participation, maybe organizing fairs, facilitating, moderating, making public health notices effective, making public forums accessible, communication of environmental risks. You know, part of your role as a community nurse will be kind of a community-oriented nursing skill or task, which is to look at the community as a whole, detect potential exposure pathways, right? Are some of these going to lead to chronic health issues, acute health issues? We talked about risk communication. We'll talk about epidemiological investigations, which we participate in. And then we as nurses can also be involved in policy development. So that's a summary of our environmental health. Does anybody have any questions about that? Environmental health is super important in the community setting because there are so many risks. Okay. I want to move to chapter 10, which is our epidemiological chapter. Why are nurses involved in epidemiology? What is epidemiology? What's epidemiology?
Like, I want to say similar to COVID. I can't put a word to it, or like the infection control in a hospital.
Mhm. Okay. What else? Did anybody have a look at this chapter? Have a look at the PowerPoints? Can you identify what an epidemiological triangle is? I'm just looking at the objectives for this chapter. Define epidemiology and basic elements. You need to know about the epidemiological triangle. I'm sorry.
No, sorry, I was saying like populations that are probably high risk too.
Mhm. Mhm.
The study of diseases.
Study of diseases. Monitoring outbreaks. You just did your discussion question. Your discussion question involves epidemiology. Okay, I know when I worked as a school nurse, sometimes I felt like an epidemiology nurse, where you're tracking in the schools, we're tracking pertussis, we're tracking chickenpox, we're tracking whatever, COVID. Okay, nurses are also always involved in the epidemiological process. Right? What's the difference between descriptive and analytic epidemiology? If you haven't read anything about this chapter in preparation for class, then this is all going to be new information for you. Okay, so please review the Healthy People 2030 objectives for epidemiology. It's on page 170. Okay, it has 3 objectives. Please review that. I would appreciate that. How do nurses use epidemiology? Right? We look at health, disease, causes of disease, how to both prevent and treat illnesses. Right? We may be using epidemiology for the whole community. We may be using it for an individual or a family. Right? It's really hard to control these larger groups in a community than it is in a hospital setting. Right? It's difficult. We talked about this in environmental risks last chapter. It's difficult to control the water, the soil, the food, air quality, garbage, trash, insects, animals, infectious diseases. Okay, the community is often exposed to many factors that you're not exposed to, say, in the hospital setting. Right? As nurses, we become involved in surveillance, monitoring disease trends. That may happen in homes, schools, workplaces, clinics, hospitals. Right? That's what your discussion question was about. Several people get ill with whatever. What do you think is going on? How would you determine what was going on? Did they eat something? Did they drink something? That's all epidemiology. So your discussion, I'm sorry?
So basically tracing?
Tracing is part of it. Yep. So the discussion question you just did was an epidemiological exercise. Okay. And we have to be able to think about the nursing process in epidemiological terms. And that's described on page 172. Okay. So when we use the nursing process, we're assessing what the needs are, identifying the problems, identifying strategies to evaluate the problems, setting priorities to put our plan in place. Okay. Couple things you need to know, and I'm going to have you go back and review them. On page 173, you need to know the basic concepts of epidemiology. You need to know the difference between proportions, rates, and risk. Okay. So everybody differs in their proportions, their rates, and their risk. Some are higher at risk than others. Some of the rates are more frequent in one community versus another community. Okay, and this section goes through those measures. It's called measures of morbidity and mortality. So please go back and read that section on 173. It goes through each of them. Okay. Okay. So there's a table in this chapter, table 10.2, it's common mortality rates. The two I want you to focus on are the crude mortality rate and the case, actually the three, crude mortality rate, cause specific rate, and case fatality rate. These are formulas. So for example, in a case fatality rate, okay, this is table 10.2. So a case fatality rate is the number of deaths and this is epidemiological terms, but you need to understand it. Number of deaths from a specific disease in a given period of time divided by the number of people diagnosed with that disease. So for example, if 87 out of 100 people are diagnosed with lung cancer die within 5 years, the 5-year case fatality rate is 87%, right? And the 5-year survival rate is 13%. How did I come up with that? And again, if you didn't do any preparation for this chapter, it gets overwhelming because it's not a lot of people are interested in epidemiology. Okay, so go back and review the case fatality rate, the cause specific rate, and the crude mortality rate. You're going to need to know that for your exam. Can somebody please explain to me what the epidemiological triangle is? What is it?
It's a model that scientists developed to study health problems.
Study the relationships, right? So within in the epidemiological triangle, you need 3 things. You need an agent, a host, and the environment. Okay. All these 3 have complex relationships among the agents, right? Agents can be bacterial, viral, whatever the disease, whatever it is, COVID. That's your agent. Bacterial, viral, chemical. You have to have an agent, then you have to have a host to infect. So your host is your susceptible people. Okay? Then you have to figure out what's going on in the environment. Okay? Does the environment make it worse? Or does the environment make it better? So for example, take COVID. The agent was your COVID. Susceptible people, it depends. You know, we found that COVID among children was less risky than COVID among the elderly, right? We found the elderly were more susceptible, right? Then you have to pull the environment into it. What if it was what if they were elderly clients living in nursing home, assisted living facilities? We know that those places exploded with COVID. So that environment put them at higher risk versus, say, the school setting. Okay, so the agent, the host, and the environment make up the epidemiological triangle. Changes in one affect the other 2. Changes in 2 of them affect the other 1. Okay, so, but they're all interrelated. And that's why it's called a triangle. The other term that goes along with this, it's called web, W-E-B, web of causation. And that's a fancy term for identifying that these three are a big web. Think of all the different scenarios that can come out of these. Okay, let's say you have a weak agent or a strong agent. Let's say you have a host that, which is you or I, that is healthy versus one that's ill, immunocompromised. And let's say the environment is challenging, or the environment's a good environment, or it's a bad environment, it creates more risk. Does that make sense? But that's what the epidemiological triangle is. Box 10.1 in this chapter gives you examples of agent, host, and environmental factors that affect the epidemiological triangle. So we talked about the agent, infectious agents, bacteria, viruses, fungi, chemical, heavy metals, toxics, pesticides, physical agents. Say you work in a plant. Are you around radiation, heat, cold, machinery? And then the host is us. What's our genetic susceptibility? Do we have a history in the family of health issues? That might play a factor. Age or sex, younger, older, male versus female, your immunological status, healthy, not healthy, lifestyle factors, diet, exercise, all these things contribute to whatever you're being exposed to. How are you going to react to it? Environment, we talked about, climate. Is the temperature cold? Is it hot? Do you live in a rural area that has lots of open space, or do you live in a crowded environment? Is there do you have social support in your community? Do you have family, friends, groups that you socialize with, or are you kind of isolated? And then socioeconomic factors within the environment also play a huge role. Education, resources, access to care. And the last part about the environment is your working conditions. Is it a very stressful environment you work in? Is it very noisy? Do you like what you're doing? Is it stressful? Is it not stressful? So all those things contribute to this web of causality. All those factors, the web it's just a tangled web of all the different scenarios that can come out of those three. Okay. The two words that you need to understand about epidemiology, three actually, and it's on page 180. If you'd like to read about it, it's in your PowerPoints as well. You need to have a definition and be able to provide examples of reliability, validity, and specificity. Those would be definitions. Okay. How do we collect data? How do we collect data for immunological studies? Well, we do it several ways. Routinely collected data, maybe vital records at the local health department, maybe data collected for other purposes, hospital records, health department records, insurance records. Maybe we collect epidemiologic data from the CDC, from our state public health department. Okay, there's two kinds of epidemiology. It's called descriptive and analytic. Okay, descriptive is exactly what it says. It describes what's going on. Okay, so it's the who, the what, the where, the when. Excuse me. Okay.
Bless you.
Oh, thank you. The who, the where, the when. Not the what yet. The who, the where, the when. Okay, so who's affected? Where were they affected? When? When were the occurrence of these disease patterns? That's what you did in your discussion question. Okay, where analytic epidemiology looks at the why. How did it happen and why did it happen? That's an important distinction. You're going to get asked about that. You're going to be given a scenario, an epidemiological scenario, and asked, should we use descriptive epidemiology? Is this descriptive or is it analytical? Okay. So descriptive is the who, where, when, and the analytical is the how did it happen and why did it happen? Okay. Then there's some different kinds of studies. Okay, table 10.3 gives you study designs. The most common we use in nursing when I did my little tracking of issues in the schools, I was always using the design model, the ecological design model. Quick, easy to get the data. The data is present already for you. You know, so how many pertussis cases do we have? How many COVID cases do we have? Easy. So that's what nurses use. Nurses in epidemiology use that most frequently, the ecological. But there's also a couple of different other study designs. There's a cross-sectional, the case control, the prospective cohort, and the retrospective cohort. Just have an idea what each of those are. And even though the bar, if you can't figure it out from table 10.3, right after that, it goes through each of them. Because I can tell you're going to once again be given a scenario and you're going to be asked which type of study design should we use? Is it a retrospective study design? Is it a prospective study design? Is it ecological? So you need to have an understanding of those. Okay. Experimental studies. Some of the other ways we get our epidemiological information from clinical trials. Everybody knows what clinical trials are, right?
They're random, like just random, kind of like surveys or treatments. You know, they don't really know much about what's going to happen.
The blind study as well.
Yep. Yep. Your levels of prevention box is on page 190, and this chapter it's related to cardiovascular disease. So here's some examples. Primary, discuss with clients low-fat diet and the need for regular exercise. Everybody understand why that's primary? Why is that primary?
Preventative.
Right. Secondary, implement blood pressure and cholesterol screening. Maybe do a treadmill test. Do we understand why that's secondary?
Screening from the word itself.
Screening. Tertiary, provide cardiac rehab, medication, surgery. Why is that tertiary?
There's already existing illness or disease.
Yeah, they already have cardiovascular disease. Now you're helping them manage it, treat it, right? So that's the major, those are the major points, not to confuse you, but those are the major points I want you to pull out of chapter 10 for epidemiology. Believe it or not, most of the time you're not even aware. I wasn't aware for a long time in my school nursing role that I was actually doing epidemiologic studies, right? I was tracking diseases within the school, tracking, doing both analytic and descriptive tracking. How did it happen? Why did it happen? Versus what classrooms are affected. I did this for 2 years with COVID. Okay. So nurses do epidemiological tasks all the time. You just don't realize that's what it is. And if you're not into epidemiology, this chapter can be a little bit overwhelming, but there are parts of it you have to pull out. Go back and look at the objectives. And I just went through the objectives, where to find the, not answers, but how you can articulate the objectives. We just went through those sections of the chapter. Okay, then the last chapter to cover is occupational nursing. What's occupational health?
Occupational health nurses usually kind of go by like sometimes their jobs. So like for me, like I work in a hospital and we have occupational health nurses that when we get hired on, we have to go through a physical, get blood work to see, you know, what we're immune to, what we're not immune to. So they're
Yep.
kind of there for like in circumstances. If you get hurt on the job, you go to occupational health to get cleared, or to get evaluated, and they kind of guide you through the steps of that, you know, process or whatever you have going on.
That's part of it. Excellent, thank you. What are occupational nurses responsible for?
Health prevention and illness.
Where? Yes, but where?
Work
In the
environment.
In the workplace. That's what occupational nursing is all about. That's what occupational health is all about. It's the workplace, right? Ensuring health and safety in the workplace.
Can we compare, because it kind of makes sense in my head. Can we compare occupational nursing to like what OSHA is to construction?
Good question. Does anybody work in an environment that's ever had an OSHA investigation or have OSHA show up and everybody panics? Why will OSHA visit you?
For quality of air, sorry.
Yep, quality of care, whatever, accident, unexpected death,
If someone calls and complains.
someone calls and complains,
Unsafe work environment.
unsafe work environment. Anybody ever prepare for an OSHA visit? It's pretty intense, is it not? Because typically OSHA's coming out when there's a problem. I mean, they do their safety checks and all that, but typically when you see them, they're coming out for a problem. Maybe an unexpected death in the OR, or a couple of them, increase in falls, whatever. There's been injury to workers, right?
The teacher yesterday for the review showed us a video about like, I guess OSHA and Amazon, because Amazon was having a lot of people who I guess was complaining about back pain and sciatica and stuff like that. So OSHA had to visit.
Because those people were developing symptoms of whatever, lifting issues, physical issues. Is that right?
Yes.
So what probably happened in that case between OSHA going to visit Amazon? What probably happened?
A lot of people were going to the doctors and complaining about like lower back pain.
Okay.
And pain in general.
And so in order to head that off, what should have Amazon been doing already?
Trying to find ways to help with like heavy liftings and stuff like that.
Teaching the right way to lift, right? How to prevent back injuries. That's what occupational health is all about. So their occupational health departments are really kind of not doing what they're supposed to be doing, because not only do they respond to injuries and deaths, but a lot of the occupational health nurses, their work is in the primary setting, right? As they walk through and do, let's say, tours of their work environment, they need to know who's working in their environment. What's their job description? What are they supposed to do? What are their responsibilities? What's their scope of practice? Right? They need to understand, what are they exposed to? Right? The goal of the occupational nurse is to keep people healthy, keep people at work. Know the job descriptions of everybody. If you're working in a noisy plant, or a cold plant or heat, or you need to know all the occupational risks in that setting. I mean, think of a hospital. You know, think of all the different roles and people that are employed in a hospital. Everybody's got a different job description. Right? How does the OR team know how to manage the equipment? Cool down the equipment. Right? What about the maintenance people? What machinery are they working with? How are they safe? Like somebody said at the beginning, when you apply for a new job, you have to go through all these screenings and make sure you have the right immunizations, the right shots, the right whatever. That's all occupational health. Okay, keeping the workplace healthy and safe. Okay, promotes the health and safety of workers. I'm just talking about her role. Here's her role: define the scope of practice, setting the standards of occupational health nursing. They also need a code of ethics. Ongoing education, continuing education. And they also should be looking at evidence-based practice. Things change, research changes. Okay, they need to keep up on the best ways to keep an environment safe, wherever that environment is. And then there's going to be lots of policy issues. There always is lots of policy issues related to occupational health and safety. That's where OSHA comes in. Some of the industries that are high risk for occupational issues, that's listed on page 579. You don't need to know the whole list, but let me ask you guys this. What kinds of industries do you guys think would be at high risk for, I don't know, maybe chronic health issues or injuries or potential death? What are some high risk industries?
Nuclear plants.
What?
Nuclear plants.
Nuclear plants, yep.
Construction
else?
workers.
Construction workers is big.
Healthcare
Veterans.
workers.
Healthcare, yep. What else?
Veterans, military personnel.
Yes. Think about the work environment, though. We're talking work environment here. What about mining?
Linemen.
Where?
Linemen.
One more time.
Like electric company linemen.
Oh, yeah, yeah. Yep, yep. What about agriculture? Why is that an at-risk work environment?
Pesticides.
What?
Pesticides.
Pesticides?
Heavy machinery.
Machinery? What about service industries? Restaurants? Healthcare?
So would contaminated water would that fall under that category?
Mm-hmm. What about contaminated food in restaurants? And then you have an outbreak. Probably going to get a visit from OSHA. Right?
They had a big outbreak of hepatitis A here in the restaurants.
Yeah.
It was gross.
Sure it was. So what are some characteristics of the changing workforce? This is what an occupational nurse has to be mindful of. How is the workforce changing? People working longer hours?
Less people want to work.
If they want to work, right?
Less training because understaffed.
Less training, that's big. Maybe job security is an issue. Maybe part-time versus temporary work.
Working multiple jobs.
Working multiple jobs. new chemicals, materials, equipment that are being used in different workplaces? What about the population? As our population increases, what's happening? Are people living longer? What's happening? Have a much older workforce, right? What does that bring with regards to, say, health issues? More chronic diseases to the workplace? That's part of the occupational nurse. She's not only dealing with injuries and illnesses, she's dealing with chronic diseases. Increase in substance abuse, mental health issues in the workplace. Occupational nursing is big. More women in the workplace, older individuals, chronic illnesses. We just talked about that. Now she's got a pretty big job. And in the bigger corporations, in the bigger places, you usually have, most of you that work in the healthcare settings, you probably have an OC health department, right? And they handle all of these things. New hires, workers with health issues. I mean, the goal is to keep people at work, not to be out on leave. Okay, the big places have occupational health departments that handle all of this, how to train for whatever your job description is, right? And then the smaller places, you typically have an occupational health nurse, and she covers all of this. Okay, so we know that in the workplace, we bring back in the epidemiological triangle. So workplace hazard could be biological, chemical, ergonomic, physical, psychosocial. And then the host is us. So the workers, how susceptible the workers, pardon me, families. And the environment, what's the environment? What's the environment that people are working in? So the epidemiological triangle is pulled right into occupational health. Okay. There's an interesting table 32.1 is really interesting. It lists job categories, what they're typically exposed to, and what they might develop. It goes through agriculture workers, automobile workers, butchers, carpenters, cement workers. So if you want to look at that, pretty interesting. So that's a review of our, I need everybody to turn their cameras on, please. That's a review of the content. I want to go through a case study. Okay. And first of all, does anybody have any questions about those 3 chapters? Those 3 chapters this week is really covered on the exam. Okay. So if you haven't done your due diligence in preparing for this week, suggest that you do it. Okay. So here's your case study. Let's talk about it. I know you already had a case study on an outbreak at the college, but here's another case study. A nurse at a summer camp for adolescents observes an excess number of people at the camp seeking help for diarrhea, vomiting during a week in late June. Normally, 2 or 3 campers per week would report to the health official these symptoms. However, now there's 23. 23 campers and staff needed help within 2 days. The nurse reported the increased incidence to the camp manager in the local health department, and the camp was closed. So here's the first question. What education should the nurse provide to the campers and staff as they go home? What should she be telling them? So let me step back. Now we're going to go into clinical judgment. We're going to take all the information we just learned and we're going to put it into a clinical setting. So now you're in a clinical setting. Now what do we do? What is she going to take? What is she going to send them home with? What information?
Hydration? What do you mean by that? Like,
I think you have to read
Yeah.
read it again because I didn't get it.
Oh, the nurse at a summer camp has observed an excess number of people at the camp seeking help for GI symptoms, diarrhea, vomiting. Okay, it's usually around 2 kids that complain per week. Now they're up to 23.
it's like
And the
food poisoning.
23 includes students and staff. So they've reported to the local health department and the camp is closed. So now they're sending everybody home. What instructions will the nurse be sending home with the campers, the kids, and the adults?
You want to make sure that you're washing your hands and cleaning the surfaces of things that you touch.
Hydration, hydrating.
Okay,
Follow up with primary care.
follow up with primary care. Yep. Hydration, follow up, wash your hands. What about swimming?
No swimming,
Why?
contamination.
From the diarrhea, right? Okay. After consulting with the health department, the local health department obtained the results of the 23 stool samples. Okay, then tested for bacterial and viral pathogens. 15 of the 23 tested positive for E. coli. Okay, the incubation period for E. coli is 3 to 4 days. Okay. After further investigation, it's suspected that the well water was contaminated as a sample was analyzed. Okay. So the question now with that additional information is this infectious disease communicable?
Yes,
Why?
Yes.
because many people had it and it's in the water.
Okay. All right. Are all the campers and the staff members susceptible hosts?
Yes.
Yes.
Why?
Because E. coli is contagious.
So demographics don't really matter, right? What about the level of health? What if you've got kids that are immunocompromised or adults that are immunocompromised? How would that have an effect?
They'll get sicker and their I guess their treatment will take longer than normal if you're immunocompromised.
Okay. What about diet, exercise, human behavior? Let's say you're obese or you have asthma. Could that be affected? Could that affect the way you come through this? Those are those environmental risks we talked about. What about genetic? Can genetic risk factors play a part in that? We're kind of talking about the epidemiological triangle here, right? The agent was the E. coli. The host was who?
People.
All the members.
All the members that got sick. And so the environment was a camp that now we know had contaminated well water. So everybody's probably going to react differently to this, right? Based on the epidemiological triangle. Would you consider this an outbreak?
Yes.
Yes,
And why?
because many people in that specific camp had it.
Okay. Then the last question I have about this is, what roles might the public health nurse or community nurse take on after a communicable disease outbreak? So let's assume you're a community nurse and you have an outbreak, whether it was your discussion question about the college kids or here at a camp. What's the role of the public health? What's the role of the nurse?
Try to contain the spread, education, wash your hands, ways to try to contain it.
Okay.
You have to report it to the health department as well.
How are you gonna, that's right. How are you going to reduce the spread of all these kids and adults when they go home to their families?
Like tracing, like everybody that, yeah.
Because this could get bigger and bigger, right?
Yeah.
Yeah, I guess you have to get the local people who deals with the well water involved as well, the environmental people.
Because they've closed the camp. So now everybody's going home into their home environment. Siblings, parents, relatives. So how do you get a handle on this?
Isolation.
Hand washing.
Hand washing, big. Do you now have a role to educate? That's why it's important what we send home with those infected people. Right? We probably are going to need to take the time communicating to family members, parents of these kids, right? How not to let it spread around the rest of the house or with friends or for overnights. And so this is a exercise in outbreaks. Outbreaks can get very out of hand very quickly. Okay, and we have a role in the community to investigate the outbreaks, educate the public. You know, this isn't a situation where we need to do any kind of risk communication to the community, but we certainly need to do risk communication with the families. Right? Okay, what else do I want to talk about as far as outbreaks? What roles do you think the local health departments and the state health departments play or assume in these kinds of outbreak scenarios?
That they're probably getting proper treatment to avoid the contamination numbers to continue to grow. Because there might be some people that won't get treatment for it, but don't realize the intensity of it.
What does a school nurse do? Should these kids be kept home from school?
Yes.
Yes.
And how do we assess how do we communicate with the parents? What do we communicate with the parents about sending these kids back to school or sending these adults back to the workplace versus not sending them to school? So what's going to happen if there's a lot of parents and send kids to school sick?
They would, if it's for the E. coli, they would have to get retested again just to be sure that it's not in their system, so they wouldn't be contaminating, other children.
What else?
So at my child's school, every year we have an outbreak in strep. It's just every year when the school year starts. So they do a really good job. The principal will actually send out like an automatic phone call to all the parents and, give them a rundown. Like if your child's sick, don't send them to school. These are the protocols. And the school nurse is very on top of symptomatic students coming through.
Okay, let's take that one step further. What do you do? What do you do about the kids in the school who are not immunized? Let's say you have a pertussis outbreak. What do you do about the kids in the school that are not immunized, or the kids that may be immunocompromised, receiving chemotherapy or radiation? What do you do about that?
Do like a little courtesy call and kind of let the parents know what's going on to give them that opportunity to decide whether they want to send their child to school or not.
Mhm. And good, that's good. What are any other thoughts on that?
Recommend maybe PPE for those that they wear proper PPE to avoid getting contaminated if they do want to attend school, and elaborate as well the hand washing for everybody.
Mhm. Let's talk about COVID for a minute. What happened with COVID?
Everything got shut down with COVID.
Everything. I mean, think of all the epidemiological, not studies, but epidemiological tracking that was going on with COVID. Right? And we had to separate out clinics and separate out into COVID rooms. Right? How, in your work settings, how did you monitor the spread and deal with the spread of COVID? What were you doing?
PPE,
So
95 masks.
for like
Pardon me?
me, I work in an ER, so we would honestly monitor everybody that would come in on a daily basis of who would have COVID. So if it was a positive result, you know, then they would mark that and track that, and you can kind of see like the amount of numbers, like the cases rising rather than lowering down. So that's kind of like one thing that we did. It was a daily survey type kind of, but you know, we would just monitor all that.
Right.
I know they were checking temperatures everywhere, wherever you go. That was like a number one thing.
Yeah, I worked at a clinic. If you had COVID symptoms, you weren't allowed in. So there, we just sent them straight to the hospital.
Yep.
In a long-term care facility, the states were requiring you to give them a census, because normally you do have to give a census as a facility protocol, but you're required to send a census of your facility, and if not, you get fined for that.
Yep, exactly. Yeah, you don't think about it. You just don't think about how epidemiology plays such a large role within our nursing profession, right? As nurses, we're always looking and tracking and evaluating and assessing, right? What else? What else do you want to talk about? I'm all done with my content. But environmental risks, play a huge role in the health of your community. And we identified lots of risks, right? Not only physical risks, but socioeconomic risks, psychosocial risks, right? And we talked about epidemiology, really know that triangle, okay? Be able to identify, is this an agent, a host, or environment? Okay, know what your studies are, your cohort studies, your retrospective, your prospective. Know a few of those. I already told you the case fatality rate, crude mortality rate, a couple of those you need to know. Okay, and occupational health nursing is huge. Occupational health nursing is huge for the community nurse. Okay, so you've got to understand the role of the occupational health nurse, what she's responsible for. Think of her as both prime. Let me just do this last exercise. What would be some primary interventions for the occupational nurse?
Checking their immunization statuses.
Okay.
Trainings.
Training for what?
Safety in the workplace.
Okay.
Infection control.
Yep. Infection control. Good one. So this is preventative training. This is what you get in new employee orientation, right? And then if you have a specific job that has additional risks, you need to be trained in that, whether it's equipment, right? Equipment or protocol or tools, whatever. Okay, and that's what happened with Amazon and musculoskeletal issues. Okay. What about secondary? What would be some secondary interventions for an occupational health nurse?
Screening. So if you're coming on as a new hire, they do some blood work exams to see if you're resistant to certain things.
Okay, what about if you're already, what about if you're already in the workplace? What kinds of secondary interventions might there be?
So maybe if you get hurt, they'll do like an x-ray of, like, let's say if it's your back or something or your neck, they'll do an x-ray to see. So like kind of like screening tests.
Would annual screenings fall under that? Physical exams, what you can lift, what you can't lift, versus
Exactly.
what you could do last year.
What's your job? What's in your job description? Right, to screening high-risk employees who, like I said, work in noisy plants or extreme heat conditions or cold conditions or working with certain equipment. How do we screen for high-risk employees? Okay, and once we've screened them and we know they're high risk, well, how do we educate them on what they're at risk for and how to minimize injury? And then what's tertiary? What would be some tertiary prevention methods in the occupational health arena?
Would one be considered, like, if you hurt yourself on the job, like physical therapy?
Yep.
Something like that.
Yep, you've had an injury, the occupational health nurse, the incident's already happened. So now you're trying to work with that employee to get them back to work, get them the services they need, right? Let's say you have a group of employees with diabetes, right? And you notice that there's been an increase recently in absenteeism for this group. What could you do as an occupational health nurse? Maybe pull this group in together and maybe do an educational session on managing their diabetes. Do they all have glucometers? Do they need resources? Right?
Maybe find them resources to help with their diabetes or doctors who specialize in this endocrine disorder. Yeah.
Let's figure out why they're absent. Is it because of their management of care? Because there's been an issue with the pharmacy with insulin at the local pharmacy? Who knows? Okay. So think about these three topics: environmental, epidemiological, and occupational. Think about the nursing process with each of these. It all looks different. It's the same ADPI, but it's applied differently in all three of these settings. Be able to identify primary, secondary, tertiary interventions in all these three areas. And please go back and review your Healthy People 2030 boxes in each of these three chapters. Okay. So now, having concluded with week 5 material, pretty much everything should be covered on your study guide. We did 3 and 4 last week and 5 today. Okay, so if you want to take a quick minute today or tomorrow while things are fresh in your mind, start plowing through that study guide. Make sure, go through it and check. Yeah, I remember covering that. Yes, we covered that. Yes, we covered that. And everything should be covered on there, not word for word, but at least all the major concepts and topics should have been covered. Okay, so that study guide is good to go for exam 2, right? Take that and use it in your reviews. If you go to reviews, bring it to your reviews, take notes on it. We're all doing the reviews with the same information. We're just presenting it in different ways. Okay?
I have a question. Are we supposed to put our name in the chat for attendance?
Yeah, please.
Okay, thank you.
Yep. Yep, yep. Okay, helpful? Did you learn a lot today? It's things you don't think about, right? I don't think about a lot of environmental risks in my environment. I should, but I don't.
These 3 chapters were a lot easier to process than previous chapters.
Oh, good, good, good.
Yeah, I think they apply more to us. Like there's more-
Absolutely.
yeah, there's more like real life situations that we're involved in with these 3 chapters.
Yeah, environmental health is community nursing. Huge part of community nursing. So, okay, well, I'm done. I'll stay on for any questions. You guys know where to find me if you need anything. I hope you have a good rest of the week. And we'll talk to you guys soon. How's that?
Thank you. You as well.
All
Thank
right.
you.
Thank you.
Thank you.
You're welcome.